Okay, good morning, everyone. It's 10 a.m. Thursday, November 20th. I'd like to call to order the Finance Planning and Investment Committee meeting. Didn't know if I was supposed to gavel before or now, but we have no citizens wishing to address the committee today. So we are on to the approval of minutes. And that's the approval of the Finance Planning Investment Committee meeting minutes on October 23rd, 2025. If I could get a motion on that.
Move approval.
All in favor say aye. Aye. Any opposed? Motion carries. Okay, so we are on to our reports and updates. This is not requiring any committee actions. So first is our master facility plan project update. I've got Brian and Ramon.
Good morning. We're going to share some very exciting updates today, some beautiful renderings of what our future campus is going to look like. Before they both start, next month is a joint board and finance and planning committee. It comes pretty short, so we won't have an additional update for the master facility program.
Good morning, everyone. Sorry. Maybe I don't need those. I don't need that, I don't think. Sorry about that. All right. Well, good morning, everyone. Wanted to kick off with some slides that we hadn't shown before, but kind of shows a lot of what we're doing with regards to our coordination. This slide right here is just showing kind of a snapshot of our hospital and the coordination that just the architect is kind of tracking. As you can see, there's different items that we have to coordinate. It's not just submitting a building permit, it's sitting down, talking with them, going over what our zoning is, going over the right-of-ways that we're going to be abandoning, establishing new easements for our utilities and things like that. So this is just a real quick snapshot that kind of shows the period of time that we're going to always in constant communications with the city. Go to the next slide. The next slide, and again, this is only a snapshot of some of the documents, meetings that we have to deal with in coordinating with the city of Fort Worth. And what we do here is we want to kind of show you the volume of it. You know, our pre-development conferences is something you have to do before you start any project. You have to have a PDC meeting with the city of Fort Worth, and we're going to be having about 7 of those. That's really to kick off those meetings. Our neighborhood empowerment zoning certificate, so you know, that is a program that the city of Fort Worth has that encourages development in areas, districts that don't have a whole lot of development. We're thankfully in one. It does a lot of waiver of fees, inspections, things like that, again, to help promote. As you can see here, we're going to have about 6 of those, 6 separate ones. Typically, when you have one, it goes for your whole project, but our projects are so split up. Sometimes even one project can be split up into 2. We're going to have different certificates. I think the one thing that I do want to point out is the certificate of appropriateness. That's a document that you have to submit or you have to receive before you can ever move forward with any of these other submissions. And it's really just due to the district that we're in. We're in the near South Side district, as we all know, and they have special district requirements. So what that paper does is anytime we submit something, we have to have a certificate of appropriateness saying, yes, you're complying with the district in order to move forward with your document. So it's something that you don't have to do in other districts, but for every document we have to have. So we're going to have 20 plus of those. The one thing I will point out down at the bottom is building and trade permits. Again, due to the nature and how we're breaking up our permitting for the hospital, just take that, 12 stories. We're not going to do one 12-story package and submit it because we have to do it in tranches in order to review, in order to continue doing design and stuff like that. So we're going to have a total of over 50 building and trade permits just for the MFP project. So I wanted to give you that quick snapshot. We're in constant communications with the city of Fort Worth. Next slide. This slide right here, instead of looking at the city's involvement, this is looking at the state involvement. Again, since we're accredited by the state, we have to submit everything to them, everything down to our enabling package. When we relocate the ambulance bay, that had to go to the state for review, approval to make sure that we're doing everything kosher, even if it is in a temporary setting. And even if it will only be in place for 3 years, we still have to go through that process. So this illustrates, again, the timeline and the deliverables and the communications that we're doing with the state for for just the hospital alone. Next slide. So one thing that we had mentioned last month was that we're going to be doing an outreach plan to help educate our community on our project and really to encourage or promote our subcontractors to take interest in our project. A lot of times we rely on just our subcontractors or putting in the paper or something like that for advertisement. I think what we're wanting to do is go a little step further and really reach out to, other community partners, our Chamber of Commerce, our small business groups at the City of Fort Worth, to help them promote to their database. So now not only are we hitting the database of our subcontractors, but we're also hitting databases of other community partners that work in our industry or help promote in our industry. So our first event is coming up on December 10th. It's at Medical Home Southwest. It will be a highlight of the MFP program in the connectivity of the subcontractors to our contractors. So while we have J. Dunn, Austin Commercial working on there, we're going to be able to tell them, look, these are the people you need to talk to. Here's how we get connected to them. Here's their scopes. Here is the bid packages. Here's the schedule for the bid packages. So people can start putting that in their minds on what they need to start getting prepared for as we start issuing bid packages. And on the next slide, you'll see this is our flyer that we've sent out. So it's a very nice flyer showing kind of our hospital. It does have the MOB in the background, so we're not only saying this is a hospital. It is going to be related to the medical outpatient building, the central utility plant, and the hospital tower. Next slide.
All right, I'm going to walk through a few renderings, but first kind of an orientation here. This was some of the original documentation being issued for the master facility program. As you can see, the part on the left has the existing hospitals that had the grassy area where there's now parking, and JPOC there on the kind of lower left, if you will, area. And the slide on the right is the intended finish product. When we're complete, you can see the garage has been placed there along with the new medical outpatient facility, the hospital. JPOC is still there. You can see the sky bridge connecting the garage up to the hospital. The newer structures are in the lighter color, and some of the existing structures to remain are in the grayish color, and just a general orientation of yesterday versus tomorrow. So these are our very new and fresh renderings from our design teams. They're very impressive. Wanted to share these with you. This is a view looking from the current hospital north of Main Street. So you can see the new bed towers to the right. JPOC is the orangish brick colors closest on the left. In between, you see the sky bridge, and then beyond the sky bridge is the new medical outpatient building, along with the parking garage to the left. Very similar view, just a dusk or a sunrise scene versus a daytime scene. And you can see in the note, some of the tone of the building looks a little different in color, just based on sun position, et cetera. So it's just kind of a different feel, different flavor, depending on time of day and, some of the evening lighting. Next one. This is looking from a different angle. This is looking south on Main Street. So right at the intersection of, where the new medical office building entrance will be, the parking garage would be right, not shown, but you see the hospital off to the left beyond the landscaped area. So this is the view looking south with the sky bridge connecting the two again. And this last one is more of a bird's eye view to kind of give you the overall campus. So you can see in the center, in the foreground, is the retention pond required for storm drainage collection. That's the green area. To the right of that, again, is the medical outpatient building, Sky Bridge connecting over to the hospital. In this one, you can see on the far left is our central utility plant, which is intentionally not visible from Main Street. And beyond that, you can see the existing hospital and the JPOC facilities beyond the Sky Bridge. So,
Brian, can
yes.
I just call out one other thing? This here is the drive on.
Yes, thank you, Dr. Duncan. That's the new apartment complex. I believe that's opening January. So, these are representing the current processes of design. MOB is a little beyond 50%. DD hospital is still right around that 50% DD mark. Meetings every month, keep going with our departmental leaders and our architects, and we're really starting to put a lot of finishing touches, so able to present some very nice looking renderings to share. Any questions?
No, but I will add one thing. Shannon and I had opportunity to meet with Trinity Metro on the different bus stops and different ways to move our patients and our employees. As this medical district becomes a little bit more congested, we've been pushing really to get rail all the way down here. So if you guys have any push on that, that would be great if you know of someone. But just wanted to let you know that that's also going on.
All right.
All right,
Fantastic. We appreciate those updates.
Thank you.
thank you. Hope you all have a nice holiday next week.
You too.
You as well. Thank you. Okay, thank you guys for that update, and we're on to item number B. We've got Kim and Hilltop here today, so
Yes.
it's going to be the annual investment portfolio and economic review. Go ahead.
Yep, thank you. Good morning. So we have Greg Warner with us to do the annual investment update for our portfolio. This is our investments. It does not include our cash that may be sitting at Chase Bank. So this is just the investment component that we have. Moving forward, we'll add the cash into the report. But right now, I just want to clarify what this is our investments. So Greg, I will turn it over to you. And
The clicker and all. All right, good morning, everyone. Thank you for allowing us the time to be here. I want to start by just a brief overview of what we're going to talk about today. So we're going to, of course, review the investment portfolio. But before we do that, just a quick introduction to Hilltop Securities and our role here with JPS Health. Essentially, we are investment managers for public entities, primarily here in the state of Texas. All of our clients are cities, counties, school districts, hospital districts, taxpayer funds. And so we are mandated to manage those funds under a law known as the Public Funds Investment Act, which places very strict limitations on what we can do. Our group specializes in this arena. We have about 60 clients, almost all of them here in Texas, and altogether we manage about $35 billion of client funds, so it's fairly sizable. We certainly work in partnership with the team here, with the finance team here at the hospital. Unlike a traditional investment manager, we don't just take your funds and start investing. It's very much a partnership. We get into the cash flows, we get into the planning. A lot of the investments we're doing are matched up with the master facility plan. And so there's a lot of back and forth and a lot of interaction in this process. We manage funds on a non-discretionary basis. That means that every transaction, every investment we make requires the approval of the finance team and the investment officers here at the hospital. So again, it's very much a partnership as we work through this. We provide market analysis, advice on investment strategy and timing. We provide cash flow analysis, investment reporting, accounting, and of course execute those transactions for you. I mentioned a moment ago about the Public Funds Investment Act. This is a state law that governs the management of these types of funds. I've provided some background here on slide number 5. I don't want to go through all these details, but the important thing to understand is that number one, the primary objective in public funds management is safety of principal. So the first thing we're trying to do is to keep you from losing money. The next objective is liquidity. We have to make sure that you have sufficient funds available to pay your bills, to meet your obligations. And then last in that order of priority is yield. And it's what we call SLY investing, safety, liquidity, yield, and it goes in that order. The Public Funds Investment Act does limit the eligible investments. Primarily, these include U.S. governments, such as United States Treasury notes and bonds, obligations of state and local governments, so municipal obligations, certificates of deposit, what we call prime commercial paper, which is just short-term corporate borrowing, and then money market mutual funds, and what we call local government investment pools, which are essentially money market mutual funds specifically geared towards public entities. The JPS policy does place a couple of additional limitations on the investment activity. Primarily, that's around the final maturity of any investment. So the policy states the final maturity of any investment is 5 years. Operating funds are actually limited to 2 years. And then the average maturity, what we call the weighted average maturity, is also limited to 2 years. The idea here is to contain the risk, reduce price exposure, reduce volatility, and make sure, again, that we have sufficient liquidity to pay all the bills.
Does our policy mirror other public hospitals?
Yes, very much so. In fact, your policy is slightly more liberal in terms of its maturity limitations. A lot of the clients that we manage have limits of 2 or 3 years, so a 5-year limitation is relatively long. It's not excessive by any stretch. But you also have some funds that you can go a little bit further out with. Your future fund, the master facility project, these are longer-term funds, and so the policy is appropriate for that type of fund.
Thank you.
On slide 6, I've included a glossary with just a handful of commonly used terms. I don't want to go through these here today in the interest of time, but they are here. You can read through them. So if you hear me using some of these words today and are not sure what I mean, feel free to flip back here. This will be your handy guide to some of the lingo that we'll use here today. And with that, I'll move on to talk about the investment report. So this report is going to cover the fiscal year ended September 30, 2025. The first slide here, we've got a summary by fund or by fund category. And there's really 5 distinct funds. Each has its own characteristics and its own strategy. The construction funds at $273 million, those represent the remaining proceeds from your 2023 bond issue. They're designated for the master facility plan. After those funds were issued and during 2023, we invested about $400 million of those proceeds with the goal of locking in yields above the bond's arbitrage yield, which is essentially the interest cost on those bonds. And we matched those maturities up to the expected spending coming from the master facility plan. The idea here essentially is to cover the interest cost of the debt while it's sitting there waiting for it to be spent for your project. That's been a very successful process. Today, there's about $210 million of those funds still invested. About $65 million is currently held in cash. Average yield is 4.35%. So we're still above that 4.20, despite the fact that interest rates have fallen pretty sharply over that period of time. So this has worked out really well for us. The future fund, about $1.2 billion, of course, is the board funds that are designated for the master facility plan. Earlier this year, during February and March, we had worked very closely with the finance staff, Courtney Bedeker and Rory McCready. We matched up investments in the future fund to the expected spending schedule in that master facility plan. At that time, we invested about $300 million at an average yield of 4.27%. And that fund has longer average maturity, so these investments are staggered out through about 2029. And as of September 30, the average yield was 4.29. And a weighted average maturity, and this is important, of a little over 1.5 years, 548 days. The reason that's important is because as interest rates are falling, the longer average maturity in this fund, the yield will hold steady. So what we try to do is we see interest rates are going to fall. We want to extend your investment maturities. We want to hold existing yields for as long as we can. And so that's one of the tasks that we've been attempting here in the future fund. Indenture agreements are set aside for bond debt service payments. Malpractice self-insurance is risk coverage for your self-insurance plan. And then finally, you have the operating fund at $880 million. Of course, that holds operational balances, includes over $250 million in overnight sort of cash equivalent investments. That fund has very frequent maturities, about $25 to $40 million every couple of weeks. And of course, the idea there is to meet your periodic spending obligations. A lot of these funds come in with ad valorem taxes towards the end of the year, and then they can be invested out to be used during the course of the next 8 to 12 months. This fund does stay relatively short. You'll see a little bit more volatility in its returns as it's more geared towards shorter term interest rates. Weighted average maturity at the end of September was 96 days. On the next slide, we've got some summary portfolio data. I realize there's a lot of information on this slide. I've highlighted a few points here. We focus on the book value and market value over there on the left. You're about $2.3 billion in book value, $2.34 billion in market value. So we do have an unrealized gain of about $10 million in the portfolio. I don't pay too much attention to that because we're going to hold all of your investments to maturity, but that doesn't indicate that we've purchased investments at yields that are higher than current market yields. So it's a favorable stance for us. Fiscal year-to-date net income came in $102.5 million. It's just a little bit above last year's $102 million. So despite the fact that we had a pretty rapidly declining interest rate environment, we were able to maintain the yield in the portfolio and maintain those earnings at a nice level. The weighted average yield on the portfolio at the end of September was 4.26%. That did decline during the course of the year. Keep in mind, over that year, we did see the Federal Reserve cut the overnight interest rate target by about 150 basis points. So the portfolio yield did decline. I do expect it will continue to decline, but we're trying to slow that rate of descent as best we can. We do have a weighted average maturity, 326 days to final maturity, and we have what we call the effective maturity, 316 days. That takes into account a handful of securities in the portfolio that are callable, that will likely be called away before they do mature. And then down there at the bottom, the transaction summary, you can see that we executed about $1.3 billion in total purchases during the course of the year, roughly the same amount maturing during the course of the year. So the portfolio, about half of the portfolio rolled over during the course of the year. That's fairly typical. On slide 10, we can see our maturity distribution and top 10 top holdings in the portfolio. We have about 20% in the overnight bucket, so this is primarily your operating funds, your liquid cash balances. And then we have investments staggered out as far as 5 years. You can see there's a pretty good concentration, 3 to 6 months, 6 to 9 months, and so on. A little bit of a blip there with nothing in that 2 to 3 year bucket. That was somewhat intentional as we worked through with the future fund and the master facility plan. We'll have investments maturing over the course of the next year to 2 years that aren't going to be immediately needed, and those will be reinvested to fill in that bucket and matched up to the master facility plan. The top holdings over on the right, a little over half the portfolio invested in United States Treasury obligations. Techstar, just shy of 17%, is one of the local government investment pools. This is a primary source of liquidity. It's essentially a cash overnight investment. And then we've got a handful of U.S. federal government agencies, as well as a couple of banks where we've placed some certificates of deposit. Now, those CDs are secured by FHLB letters of credit, so they are secured deposits. On the next page, you can see the allocation by security type, by investment type. The first 3 items on the right, agencies, agency callables, and agency step-up notes, those are all government agencies, make up about 15% of the portfolio. The last item on that list is U.S. government, U.S. Treasuries, a little over 50%. So government and agencies make up about 65% of the portfolio. Local government investment pools, which are also invested in government agencies, make up about 18%. So roughly 80% of the portfolio is in U.S. government and government agency securities. We do have about 10% in certificates of deposit and about 5% in commercial paper, a little bit in municipal bonds and a little bit in bank deposits as well. The next page is a credit rating summary. So this shows the credit ratings on the portfolio. As you might imagine, with so much invested in government obligations, very highly rated portfolio. Most of it matches the federal government's rating at AA+. You'll also see there's a AAA category there. That is the local government investment pools. The A1+ is commercial paper. That's actually the highest rating available in short-term commercial paper obligations. And then the item noted as SD, secured deposits. These are the bank CDs and bank deposits that are secured by letters of credit. The next page shows a benchmark comparison. This shows the weighted average yield of the portfolio at each month end across time. The red line is JPS's portfolio. And you can see that over the course of 2023 and 24, coming out of a period where the Fed had been rapidly increasing interest rates, the portfolio did lag on the way up a little bit, so we fell a little bit behind those benchmarks. This year, we've caught back up, and the reality is the benchmarks have fallen because the interest rate environment has been declining rather rapidly. The portfolio is not going to decline as rapidly, and you can see over at the far right, as of the end of September, the portfolio yield is now ahead of all of those benchmarks. I'd also add that the Fed did cut interest rates in September, again in October, and so we do expect to see these benchmarks continue to fall. And again, as I said earlier, your portfolio yield will fall as well, but we don't expect that it will fall as quickly. We also anticipate additional rate cuts will be in the works next year, and I'll talk about that here in just a moment. And with that, I guess I'm jumping into the economic outlook and the interest rate outlook. I've got a lot of
Just
slides
real
here.
quickly, I'm
Yeah.
sorry, before we hop to that, I didn't know if anyone had any questions about the portfolio and the type of investments and returns, or if there was any further discussion there. Just to be clear, you'd mentioned 80% of our portfolio is in U.S. securities, is that right?
Well, about 51% of the portfolio is invested in U.S. government obligations.
Okay. And you mentioned commercial notes. What exactly, could you define that?
Commercial paper is short-term borrowing from companies. The primary issuers that we use is Toyota Motor Credit, RBC Bank. I'm drawing a blank here as I sit in front of you now on a couple of them. JP Morgan
Right.
is another one that we use. So these are very short-term obligations of corporations. It's actually the only corporate credit that we're allowed to invest in per the Public Funds Investment Act.
And the CDs, you mentioned that these are all pretty short maturities, just due to policy, is that right?
The certificates of deposit generally go out 1 to 2 years. That's
Okay.
largely dependent on the bank and the interest rate that they offer.
Okay.
So we take advantage of CDs when they offer yields higher than what we can get in other instruments. During 21, 22, when we saw a zero rate environment, bank CDs were very attractive. We had a much higher allocation to them at that time. We've been moving away from them this last year because they're not as attractive relative to the other options. Those are secured by FHLB letters of credit.
So you mentioned the 5-year maturities was also policy. So do we have investments that are out 5 years?
You do. We don't have a whole lot in the 5-year area, but we do have some investments that extend out there. The 3 to 4 year bucket is where we have the bulk of the longer term investments. Again, most of this is geared up towards the master facility plan and the bond construction.
And we'll be reevaluating the spend and with them shortly in the next few months.
Great.
We have a revised quarterly spending pattern, so we'll have to revisit that as well as looking at the investment policy again and everything.
Thank you.
We've been in a we've been in a fairly challenging environment for the last 8 to 9 months because, not to get too wordy, but it's what we call an inverted yield curve, which basically means that overnight interest rates are higher than interest rates further out in maturities. So as I sit here today, we're earning about 4% in overnights. 5-year is earning about 3.65. So as we extend our maturities, we're actually giving up yield. We do that because we anticipate the overnight rates to be falling, but there's a bit of a trade-off there. It's something that we try to balance very carefully.
Do we have any type of anticipation on what's ahead of us as far as return on this cash? Or have we set any bogey out there yet as far as
I won't
year?
say that we've set a bogey out there, but I would expect, given the current rate environment, the average maturity of the portfolio, which today is about 316 days, we're currently earning a 4 1/4. We're going to hold relatively steady. I expect that we'll be somewhere in the range of 3.75 to 4%. That will depend, partly on how quickly the Federal Reserve lowers the overnight Fed funds target, which we do expect additional cuts next year. And it will, of course, depend on the timing of your cash flows and the funds coming in and out of the portfolio.
Thank you.
Sure. Anyone else before I move on?
You said 50% is federal government, the other 80% of total is actually government of some form, right?
Yeah, so 51% is in U.S. Treasury obligations.
Thank you for clarifying that, Dr. Fowler. Right.
Yeah, about 15% is
Right.
in government agencies, and then another 18% is in local government investment pools, which invest in government securities. So yes, about 80% is
Right.
government and
Gotcha.
agency securities.
Appreciate that.
Sure. Okay, so the economic and interest rate outlook. I've got 25 slides in here. I realize you guys don't want me to take a lot of time to go through 25 slides here. So I am going to blast through these pretty quickly. Feel free to jump in, ask questions if you need to. But the slides are there, they're annotated, there's a lot of notes, so you'll be able to get the picture really quickly. And I'm just gonna blast through these in the next 5 or 6 minutes. Couple of important things. Number one, inflation continues to run a little bit above the Fed's target, about 3% versus a 2% target. Number two, employment is clearly slowing. So unemployment is rising, job creation is slowing. Nonetheless, we're seeing pretty resilient consumers continue to spend. We do expect that the Fed is going to be cutting interest rates again next year. We've just come out of a government shutdown, which has caused some consternation and some difficulties. And then, of course, the trade war, the tariff policies, still definitely a wild card. The Supreme Court is considering the legality of the president's tariff actions. That could have an impact on us next year as well. I mentioned job growth is slowing. This chart shows the number of jobs being created on a monthly basis. Clearly, you can see the bars at the right are getting smaller than the bars at the left, right? So we're seeing slower job growth. I'll also point out that the original report, which is the gray bar, versus the blue bar, which is the revised report. Revisions the last few months have mostly been down. That's an indicator that job creation is slowing. This is a number that has been stalled, so these are a little bit stale. We just got the September report this morning, actually showed a little bit of improvement in job creation in the month of September. This is a report from ADP. It's a private payroll provider. Again, they are showing slowing job growth. This looks at the 3-month average of private payrolls from the Bureau of Labor Statistics versus that ADP number. Again, the point here is that they are slowing. We've begun looking at the ADP numbers a little bit more in the absence of the official government report, but you can see that there's a correlation between these two. And with the ADP number falling, we would expect that the private payrolls from the Bureau of Labor Statistics is likely going to follow, maybe not in lockstep, but heading in that general direction. The overarching point, of course, is that employment conditions are slowing. This is the unemployment rate. The line at the top of the red is what we call the underemployment rate. This counts people who have given up the search for a job or who are working part-time but would like a full-time job. That's running at about 8%. The official unemployment measure is 4.3%. This morning's labor report showed that it rose to 4.4% in September. So again, we're seeing a gradual increase in the unemployment rate. This is inflation. It breaks it down by component. The red line is what we call the core rate. This is the most important line for us. You can see after falling from a pretty high level in 22, declined very rapidly in 23 and 24. It's kind of flattened out here in 25. We're running at about 3%. Again, that's above target. The Fed would like to see this come down. It's one of the reasons why it looks like the Fed is not going to cut interest rates at the December meeting. This is another look at inflation. This is the Fed's preferred measure, Personal Consumption Expenditures Index, running at about 3%. Again, the Fed has a 2% target. Clearly, it's above target. Previous meetings, I've been asked to provide some data on medical care services and inflation in medical care services. So this is looking at that component. The 10-year average increase for medical care services is 2.9%. Through September, it was running at 3.9%. So inflation in medical care services is running about 1% above its long-term average. Medical care goods, on the other hand, which is not shown on the chart here, but I've got a bullet point there actually running a little bit below the 10-year average. This looks at retail sales, so think consumer spending. This looks pretty healthy, a little bit surprising given all the news that we've been reading. It is leading to a lot of discussion about a K-shaped economy where folks in the higher income cohorts are able to maintain their spending. Folks in the lower income cohorts are struggling a little bit. But nonetheless, the aggregate numbers show that consumer spending remains fairly healthy. This is home sales. Home sales are running at very low, essentially recession-era levels, just about 4 million units per year, which is a very low level. You've probably heard discussion about mortgage lock. People who have very low mortgage rates on their houses aren't interested in selling those houses and buying more expensive houses at higher mortgage rates. And so the lack of supply is keeping a lid on home sales. This is home prices. Important point here is after a rapid rise, we have seen home price increases level off, but what you don't see is a big decline in home prices. So home prices are flattening out, but this has caused some issues for affordability. With very high home prices, very high mortgage rates, homes are not affordable for a lot of folks. And in fact, the median age of a first-time home buyer has now climbed above 40. And that's very important for future economic indicators. If you think about everything that goes in when you buy a new house, if you're a young couple, you start a family, you buy all the furniture, you buy all the stuff, maybe you have kids. If those things get delayed, it can have a macroeconomic impact down the road. This looks at gross domestic product. This is essentially the scorecard for the economy. You can see in the first quarter, we actually had a negative growth. That's because imports subtract from GDP because they're not produced domestically. In the first quarter, we had a lot of imports as companies were trying to get in front of tariffs. That reversed in the second quarter. We saw a big rebound. We think the correct way to look at this is to average the two, 1.6% growth in the first half. A little bit less than 2024, but not terrible. This is a measure from the Atlanta Fed, looks at the estimate for the third quarter, which right now is running at about 4%. So it looks like we're going to have a very strong third quarter. A lot of evidence that AI spending is helping to drive economic growth here in the third quarter. This is what we call the dot plot coming from the Federal Reserve. I told you I was going to go through these fast, didn't I? This is the dot plot coming from the Federal Reserve's September meeting. Essentially, this is members' expectations for interest rates going forward. You can see there the box under 2026, pretty wide disparity of the dots. Each dot represents one member's expectation for interest rates. There's not a whole lot of consensus about where we're going in 2026. As you move into 27 and 28, you can see that generally the expectation is that we're going to decline. We're right at 4% today. Looks like we're heading to something closer to 3% over the course of the next year or two if these hold out. I'm going to skip through a couple of these. These get rather technical. This is Fed funds futures. So this is looking out at each FOMC meeting date, each Federal Reserve meeting date next year, and shows us what is expected at that meeting. I can tell you that the odds of a December cut are much lower than they are on this slide, which I had to take a couple of weeks ago. So we don't expect a December rate cut. Nonetheless, you can see at the very bottom in that red box, by next December, the implied rate over on the far right, expected to be just above 3%. That holds today. Now, the timing is shifted out. What this tells us is that we're expecting the Federal Reserve is going to cut the overnight Fed funds target by 25 basis points at 3 different meetings next year. Again, the timing's unclear, but the expectation is that interest rates will be declining into the future. That, of course, impacts Treasury yields. So what you're looking at here is the yield on the 2-year Treasury note. It's a very important indicator for us as a lot of our investing is done in that area. We have recently stabilized in around a 350 to 360 range on the 2-year Treasury note, but clearly that yield has fallen during the course of this year. It's likely to fall a little bit further next year as we get closer to some more Fed rate cuts. And I'm going to skip to the very end. You know, in terms of the outlook, Fed policy is still somewhat restrictive. That's why they've been lowering the Fed funds target rate. They're trying to provide a little bit of support to the job market, but they've still got an eye on inflation. And with inflation running a little bit hotter, looks like they're probably going to delay their rate cuts until early part of next year. We also are going to see a new Fed chairman who will be appointed by President Trump next year. President Trump has made a lot of noise about he wants lower interest rates. We expect the new chair would probably be more of an advocate for lower interest rates. It's another reason we think that we're likely to see lower interest rates next year. And I'm going to quit there. I think I've used up more than my fair share of time. Happy to answer any questions.
Appreciate that update from Hilltop, so thank you.
Thank you.
All right, Ken. Are we on to the action items? Or
Yes.
are we, okay, I'm sorry, okay.
Yep.
This is our CFO update. Action item number A is to consider to approve the October 2025 unaudited financial reports. Go ahead, Kim.
Absolutely, thank you. So as a reminder, this is the first month of our new fiscal year, so October, it's just 1 month of data, whether you're looking at month-to-date or year-to-date. I will have to tell you that we did close out 25. The audit is going well. As far as we know, as of yesterday, there's no findings for the audit. We'll be presenting the audit for approval at the meeting in December. We also are working on fiscal 27 budget planning, believe it or not. So that is underway. So we will be looking to have a retreat in the first half of the calendar year, near the end of the first half next year with the board. Similar to last year, but a little bit earlier. But let me get you back to this year, so let's talk about fiscal '26. You can see from this short version of the narrative that we have pretty consistent themes that we've seen. The revenue has continued to be strengthened by volumes. So our volumes continue to surpass. We have surge opportunities. We have a lot of patients in-house. We are seeing record numbers of patients in the emergency room department. And so really a lot of volume coming through the organization. Unfortunately, that is offset by lower than expected payment rates, which are primarily related to payer mix, and we'll see that later in the deck. And also the case mix index is down with a little bit lower acuity in our patient population that we're seeing. Retail pharmacy growth has continued to grow. We've been very successful at this service line, and you'll see that it's a line on the income statement where you can see that. But net of drug costs, we're about $500,000 ahead of where we had planned to be. And then expense management, we have some, we'll talk about the increase in the pharmacy expenses that you see, as well as we've had some really good labor management going on for the month of October. So we are starting off in a very stable environment, a very stable place, but we do have to keep the environment basically in the forefront. We have a lot of headwinds coming at us. We might get a tailwind. We know we always get those surprises. But we have a lot of headwinds between the state, the federal, the local government, environmental factors, including the ACA subsidies that are to go away January 1st. We have the 340B pilot program that is starting January 1st. That actually will have a cash flow impact on us because we have to outlay almost on an annual basis over $50 million for something that we normally would pay $2.5 million for. So that pilot program is causing us about a 30-day delay in cash of about $50 million. Think about the returns we could get for just a month on that cash. So we'll be watching that program very closely and having to accelerate and put resources towards getting our rebate as quickly as possible. But those are some of the headwinds that we are facing going into the year. When we look at how October did turn out, this is the consolidated income statement. First line is the net patient revenue. I had talked about it's primarily volume offset by some of the negative rate. The supplemental Medicaid funding, there were no surprises. We accrued to what we're expecting to get for this year. We see retail pharmacy, the revenue is up. Below, you'll see a negative variance in supplies and pharmaceuticals. That's where the offset of about $1 million of supply expense sits. And then other revenue is up. And in other revenue, we have the patient assistance program for pharmacy. The revenue sits up there, and we are doing a lot more for our patients, so that revenue is very high. It's about $2.4 million higher than expected. We have an offsetting expense down in pharmaceuticals. So a lot more revenue coming in to support our patients. It's a direct offset down in expenses. So total operating revenue is $5.6 million over target for the month. As we look at expenses, just a few things of note. We have the wages and benefits expense. We're efficient with our staff. We did have an increased expense in pharmacy, and we're seeing that primarily centered around, as you can imagine, the GLPs. And that would be Mounjaro, and I want to say Wegovy, but there's 4 of them, and then 2 are weight loss and 2 are diabetes. So you guys are familiar with everything going on in the market, but they're very expensive for the care that's being provided, but it's having great success with our patients. The other thing that is going on in pharmaceuticals is we had pharmacy, of the 5.3, about $2 million of it is related to volume, and then we had one patient that had $1 million drug expense as an inpatient for us. That variance, those are consignment drugs, by the way, so they're only incurred when we actually need them for these patients with this great need. Overall operating income before the ad valorem was $1.2 million favorable to budget, and then net income basically $1.1 million. Investments were on target for what had been planned. When you see it visually, the green bars are the cumulative budget as we go through the year for operating income. It includes ad valorem and interest expense, so it's operating income, not interest expense, but ad valorem. You'll see the green bars are the budget, the blue will be our actual performance, and the red line is budget. Not very exciting when it's the first month of the year. So, In case you wanted a short version of the reconciliation that I just talked about, this talks about the main drivers from going from a budget of 6.3 million to 7.5 million. And it shows you the major areas of impact to the financials for October. We did have one small CHIRP reconciliation of 400,000 that does hit patient revenue. CHIRP hits patient revenue, not the supplemental line, so it does fall in the patient revenue line. So the operating ratios here on this page, really we talked about operating margin is 4.7 versus a budget of 4.1. Our operating expense per day is about just under $4.8 million a day to operate. FTEs, as you can see, we're slightly under budget, which is great. We are managing the staff. Some of that is the productivity work we're doing, and we are also looking at every FTE as we're looking to replace or put new FTEs in place. On the balance sheet, I do want to note that on the days cash on hand, you'll see that we're at 415 days. The operating is at 171. Our target is 180. We do have policy in place that if we fall below 180 for more than 6 months, there needs to be action taken. We expect to be back up to 180 by December. We get over half of our ad valorem revenue in December, so it does dip for the first 2 months of the year. All right, this is a subset of the statistics that are on page 71 of your packet. At the top, I've highlighted our total outpatient visits. These are the visits we see, almost over 110,000 outpatient visits in the month of October. If you add in the acute discharges, and that's not patient days, it's just one admission, it's almost 114,000 visits we do in a month. Our acute discharges were on target. We talked about the volume. The length of stay is a little higher than anticipated. Surgery cases, there's 2 sections on surgery cases. Our routine counting of surgery cases are the cases that happen in the ORs. That is normal across the industry. However, some of you may be aware, particularly physicians, we have been taking 3 rooms down to actually do the HVAC replacement in the ORs. And so we felt it was important to also add the endo and the IR interventional radiology rooms because we are doing some procedures in those rooms that normally would be done in the OR in order to help that. So together, we're actually slightly over budget in our procedural area for October. Emergency room visits, we continue to be very busy in the emergency room. We're basically 6 off budget. I don't know how that happened. It's usually not an exact science, but it's close. And then the PEC, slightly under budget for the month. As we were building the PEC, we know that many organizations and hospitals really developed a way to take care of their patients with behavioral health opportunities or challenges in the medical EDs and in their organizations. But we're working with the EMS. We're continuing to see patients come into the PEC. And then on the clinic visits for the organization, slightly under, we continue to work on how do we optimize in Epic our templates so we can have our patients being seen as quickly as possible for the care that they need outside of the hospital. Payer mix. This payer mix is October last year compared to October this year with the budget in the middle. And I boxed off the middle 3 and put the movement from the budget to the month of October so you can see really what is happening here. We're seeing a decline in Medicaid. We're seeing an increase in connection, and we're seeing a decrease in commercial. Self-pay and Medicare are staying flat. What that is meaning is that we're seeing an increase in our lower payment for the care we're providing. The decline in Medicaid, we probably expect to see that come up a little bit, but that's also there are some people falling off the Medicaid eligibility because they were part of the expansion during COVID. And they're no longer eligible after the verifications. So we're seeing that. We're tracking this very closely because this really can impact our performance as an organization. The balance sheet, we talked a little bit about the days cash on hand. The cash, our operating cash is the very first line. The box section below, the future fund cash that goes into the days cash on hand is the first line or the $1,173,000,000, and then there's what's left currently of the bond proceeds. And what's left of the bond proceeds to be spent also includes any interest income that we're receiving on those. We did do the evaluation. We do have a slight arbitrage where we potentially will have to make a repayment because, as Hilltop said, we have been making an interest rate higher than the debt interest rate. So we'll continue to monitor that for the organization. The only other one I want to point out, just for knowledge of the board, if you go down under non-current liabilities, you'll see our long-term debt at $435 million. That has 3 debt elements. We have a 2012, 16, and a 23. 12 will be expiring next year, 16 in another few years, and then that will just leave us with the 23 as we look at what will be our next steps for the next tranche of debt for the master facility plan. A couple of the key ratios, you saw those during the budget process. I want to keep days cash on hand out front. And then net days in accounts receivable. We want to see this go down. We may see this go up during the year as we work on initiatives in revenue cycle. We have some opportunity there, and these numbers are good, except for I think we have some more opportunity to actually collect some more revenue and do some different things in the revenue cycle. So just foresight on that. The last page here, this is in your also in your book. For fiscal 26, we isolated the goals, the financial goals that we're looking at for finance. There are 12 of them. I put the annual target that we're looking at. If it's from the strategic scorecard, it would be the target there, otherwise it's the budget. And we're keeping the annual number there so we know what we're trending towards. The year-to-date will be the colored column, and then the direction we want this metric to go will be in the arrow in the last column. So operating margin, which we're familiar with, that's part of the strategic scorecard. We have net patient revenue per case mix adjusted equivalent discharge. This really looks at our revenue expected from each care delivery opportunity. This replaced actually operating revenue per adjusted patient day. We really wanted to look at the net patient revenue because the supplementals, the pharmacy are different types of revenue. Bad debt and charity as a percent of gross revenue, this potentially is a leading indicator for us of where we might have some financial strain as we have more self-pay patients and we have more bad debt. I struggle with whether this should go up or down because our mission is to take care of all the patients, so I leave it as a flat metric. Okay, so if it goes up and we're taking care of the patients, great. If it goes down and we're collecting more, that's great too. So we have the labor expense ratio. That is the strategic scorecard metric, and that 79.4 is what is on the scorecard presented at the board meeting. Total FTEs per adjusted patient day would allow us to then look at hours. The labor expense ratio, we really wanted to look at dollars to make sure that we're spending the right dollars, but we also want to keep track of the hours. And so as a secondary measure, we want to look at FTEs per adjusted patient day. We'll look at overtime because that's a good indicator if we think we're going to see some escalating costs in the organization. Supply and pharmacy expense ratio, this is actually these expenses from the income statement divided by total revenue. Supplemental, any revenue we get in order to pay for our supplies and other operating costs. Days cash on hand, net days in AR. For throughput, we have left without being seen from the emergency room. We're doing an excellent job keeping that at under 2%. Length of stay, and then the JPS connection membership. We took a few off, just so you know what we did take off. We took off the operating revenue per adjusted patient day, operating expense per adjusted patient day, the specialty pharmacy revenue, you can see that on the income statement, premium pay hours, and then the Medicare retention for JPS connection. We are tracking that. It's a subset of really looking at the payer mix that we have for the organization, but we are continuing to track that. So with that, caution. First month of the year, we're starting out in a stable way, but we do have a lot of headwinds coming our way. And so I look forward to understanding those more as the months go on. So any questions from the group?
I think with the 340B, you mentioned we anticipate about a $50 million cash flow issue related to what we would have spent about $2.5 million with the original plan versus having to
It's probably gonna be one FTE, if not two FTEs. It's really a tech and someone basically working with the rebate, intermediary. There's one, fortunately, there is one tool that's being used for that. Each pharmaceutical company doesn't have their own. Which we thought at first, we're gonna have 9 different ways to submit these. There's gonna be one.
Okay, Kim, thank you for that update. With that, we'll need a motion, if no further discussion. Okay, first and second, everyone in favor, aye? Any opposed? The motion carries, sorry. So, thank you, Kim. Item B, consider approval of pathology professional service agreement between Tarrant County Hospital District and ProPath Associates and ProPath Services LLC. We've got Dr. Assad.
Thank you very much for having me here. I would like the board to consider approval of pathology contract. This will be an agreement between Tarrant County Hospital District and ProPath Associates and ProPath Services. This is going to be a 5-year contract, and the total cost of this contract is going to be $33,022,785. This was awarded through an RFP process to the incumbent. It will allow us to have clinician services and reference lab services.
Any questions for Dr. Assad? If none, I'd like to get a motion, please.
So moved.
Let's get a first,
Second.
a second. All in favor, say aye. Any opposed? Motion carries. Thank you, Dr. Assad. Okay, item C is to consider approval of the amendment to the participation agreement for Vizient Product Supplier Agreement between Tarrant County Hospital District and Guy Brown. Charlie Cobb, thank you, sir.
Good morning. For your consideration, this is a renegotiated contract under Vizient with Guy Brown. They are our incumbent, but we did negotiate with all Vizient suppliers to improve pricing, standardize our formulary, and get best value for the organization. This is roughly $800,000 a year, $1.6 million over 2 years. Again, a lot of work to control our office supply costs with this agreement.
All right, any questions? None. If I could get a motion, please. All right, I've got a first from Dr. Fowler, second. Dorothy. All in favor, say aye. Any opposed? The motion carries. Thank you, sir.
Thank you.
Let's see here. So we've got item D. That's also you as well, Charlie. So go ahead. It's to consider the approval of pricing agreement between Tarrant County Hospital District and AbbVie US LLC.
Yes, this was a result of an RFP. This contract is for breast implants, sizers, and related products for reconstructive breast procedures. This represents about 80% of our spend in this market. We have another contract with Mentor. There's some sizing and some special products that we needed them on contract. For AbbVie, it results of it's roughly about $250,000 annual spend, but it does also represent a $25,000 a year savings in this new contract.
All right, thank you, sir. With no further discussion, if I could get a motion.
So moved.
Okay, I've got Dr. Casey first, got Reverend second. Everyone in favor? Any opposed? The motion carries. Thank you, sir.
Great, thank you.
Okay, we've got item E, Will, come on up. It's to consider approval of Innova Solution Cloud Services Statement of Work number 3 between Tarrant County Hospital District and Innova Solutions.
Good morning.
Good morning,
So let me
sir.
put it into context. This is the second wave of our journey to the cloud. It's with Innova, as you said, they're on DIR contract. This represents about $1.6 million for year 1 to do the build, the data migration, the Azure service, and then $450 on a regular basis for the Azure service. It's aligned to our MSA, and it is budgeted. Any questions?
With no further questions, we'll take a motion.
So moved.
All right, Dr. Casey, Reverend, or Demetrius, second. All in favor? Any opposed?
Thank
Motion
you very
carries.
much.
Thank you, Will. Okay. I think that wraps up all of the action items. We've got no closed session today, is that right? So that adjourns this meeting at 11 o'clock. Thank you, guys.
Done. Good meeting.
What's that?